Now we are going to learn what forms the nose. Its cartilages, muscles, fat tissues, and to examine various shapes of noses. What constitutes the nose? This is amazing Atlas of Human Anatomy with illustrations by Frank Natter. And first of all, let's enumerate the bones. This is the maxilla or upper jaw. This is the nasal bone. This spot is called nasion. This is the acanthion or anterior nasal spine of maxilla. This is the bony part of nasal septum. No, cartilage part. Okay. So this is the bony part of nasal septum, and this is its cartilage part. These are upper or superior lateral nasal cartilages, and these are major or greater or lower alar cartilages. And these are muscles of the nose. The transverse part of nasalis, the alar part of it, and this is the depressor septi nasi muscle that lowers the septum. And this muscle, levator labii superioris helicoid nasi muscle, raises the upper lip and the wing of nose. These are nostrils and wings of nose. They are formed by skin from outside and inside, and some fat tissue in between. Now let's talk in more details. Look at this picture of a skull and nose cartilages. The upper cartilages, these cartilages, are attached to the nasal bone and form with it the nasal arch or dorsum of nose. So if the nasal arch is straight, the nose is straight, like there. If there is a bulge, it's most prominent at the point of connection of the cartilages and the nasal bone. If you wish to get rid of your bulge, a plastic surgeon can remove it in the following way. First, the surgeon cuts the skin and removes it to get access to the cartilages. Then he cuts the cartilages of the bulge. So, and then the bones. After this, the truncated nasal arch with sagging skin looks too wide. And this is fixed by osteotomy, or the surgical cutting or dividing of bone, usually to correct a deformity. So for this they are cut here. Yes, here. Brought together and fixed, so the bones are set closer, like on this picture. These are the photos before and after the rhinoplasty, including the bulge removal. The form and shape of the upper lateral nasal cartilages have a great impact at the nose shape. For example, Christian Bale's cartilages are long, so his nose is longer here, while Charlize Theron's one is shorter, and her nose is smaller and shorter. The cartilages are interconnected by fibrous tissue and covered by the skin from the outside and the inside, and there is some fat tissue under the skin. So the cartilages are supported and moved by the nose muscles. The greater nasal cartilages or lower nasal cartilages are thin and C-shaped. The greater nasal cartilages are joined to each other by fibrous tissue. Fibrous tissue also joins the back of the greater nasal cartilage to the maxilla. The greater nasal cartilages are responsible for the open position of nostrils. Without them, the skin would sag and nostrils shut up and we stop breathing. So, each cartilage has the shape of a hook with two stalks, the external and the internal. External, internal. The tip of the nose is the band between them, this spot. The lower stalk forms a columella, actually this small column. By the way, when rhinoplasty is done by open cut method, this cut to lift the skin and get access to the cartilages is done in the narrowest part of the columella, so that the scar wasn't seen. So if you touch this spot on your own nose, you can easily pull back the columella and move these greater nasal cartilages together with the skin. And you can also press the nose tip with your finger and feel that there is distance between the right and the left cartilages there. So, and if this distance is always seen, even if not pressed, the nose tip is called split, like this girl's nose. The red triangle shows the base of the nose and the holes are nostrils. The shape of nose greatly depends on the size and shape of the greater nasal cartilages. As we've mentioned, the greater nasal cartilage is C-shaped and has an upper and a lower stalk. However, they intersect with some curvature and not at the right angle. So each person has an individual shape of the nose tip. Someone's long and someone's short and small. That's why the nose tips are so round, like there. However, for some people, this feature is more accentuated. For example, look at Monica Bellucci, Natalie Portman, Britney Spears, Charlize Theron, Jessica Alba, and Scarlett Johansson. And this is just one of the possible shapes of the lower lateral cartilages. Look at these photos. Here are some totally different noses. For example, Zachary Quinto, Sarah Jessica Parker, Owen Wilson, and Adam Sandler have similar lateral cartilages, while the ones of Kate Blanchett and Jude Law are somewhat different and also similar. And yes, it's interesting how much like the noses of Oleg Tinkov and Paris Hilton. Christian Bale also has an oddly shaped cartilage. His transition of his upper stalk to the lower is big and almost, well, greater than the upper stalk itself. If someone is not satisfied with the size or the shape of his cartilages, rhinoplasty can successfully change them, as it's done on the photos, for example. That's if the surgeon is a real professional. So these are the photos of a repeated rhinoplasty on the noses which have already been operated, however, without success. At first, in any case, if the rhinoplasty was successful or not, the cartilages get covered with a layer of connective tissue. And if the first operation was done badly, during the second one, the surgeon will have to accurately remove this connective tissue and do it to avoid damaging the cartilage beneath. So it's very hard and hard. And these photos show a horrible accident. When the previous surgeon operated on the cartilages, he's combined them awry and set them in a way unknown to the medicine. And then he sewed them, well, in a way really unknown to the medicine, as if he was sewing a sock or something. So one has to be very wise and picky when choosing a surgeon. So let's compare two different shapes of noses. With some people, for example, Adam Sandler, the outline of his cartilages is clearly seen by the nose, and with others it's not. For example, Nicolas Cage. Why? This is because the tissues that cover Adam Sandler's cartilage are thin, so the cartilage shape is projected on the nose surface. And these tissues are skin, subdermal fat tissue, and nasal muscles. If the muscles of the nose are well developed, it becomes more beefy and smoother with a rounded tip, because it replicates the shape of muscles. Well, the nose muscles of Nicolas Cage are rather well developed, and the shape of his nose reflects the shape of muscles. And if the fat tissue under the skin is rather thick too, the nose becomes even more sleek and streamlined. If there is a lot of fat tissue in the wings of nose, the wings become greater. And however, they do not do so automatically. If someone puts on weight, it's possible that his face remains thin. This means that the fat is distributed unequally on the face. So now let's enumerate the nasal muscles. The transverse part of nasalis arises from the maxilla in the region overlying the root of the canine tooth. Its fibers pass over the dorsum of the nose to join the muscle from the opposite side. For example,
I show how
Jessica
it works.
Zor, Miley Cyrus, Kate Middleton, and
When
many
it's
more
stretched, these
have a
folds
very
are
small
formed.
curve. And this is the ala part of nasalis. This muscle originates from the maxilla in the region of the lateral incisor and inserts into the greater nasal cartilage. It draws the ala of nose downward and laterally to dilate the nostrils. And this is the depressor septi muscle, or depressor septi, I don't know how to pronounce. It rises from the incisor region of the maxilla, rises under the orbicular mouth muscle, and is attached to the skin of that covered the nasal septum. So nasal septum is here. This is the nasal septum. And how it works? It lowers that skin of nasal septum and closes the nostrils in this way. So, and this muscle, called levator labii superioris liquid nasi muscle. The liquid nasi muscle begins at the upper jaw, at the upper part of the frontal process of maxilla. Then it passes forwards and laterally at an oblique angle where it divides into medial and lateral slips. The medial slips joins the big lateral nose cartilage and the skin above the cartilage. When this split works, the nostrils widen, and the lateral slip is woven into the orbicular mouth muscle. When it works, the upper lip is lifted. So, like this. Now I give more examples of muscle-bounded noses. It doesn't mean that they have been purposely worked out. These muscles are naturally well developed and big just because the masters have been born with them. To illustrate how the growing muscles change the nose shape, I give this example. So so the shape of nasal bones and cartilages of Evgeny Mironov and Tatiana Kolganova is very similar. We see that the development of nasal muscles also develops the nose wings, despite that they consist mostly of fat. So anyways, certainly there is a question of the shape of bones and cartilages of these people is absolutely identical. But yes, but I think I have to show it. The nose tip, like there, becomes smoother. It doesn't repeat the shape of the cartilages. Because the muscles lying on it are greater. Now they form smoother around the tip themselves. If we add to this a great amount of fat tissue in the nose wings, although in Mironov's case it's not great, and if there is much fat under the nose skin as well, the nose becomes even more smooth, rounded, and streamlined. And it's also necessary to tell about the bony prominence on the upper jaw, which is called the acanthion. Well, its size also impacts on the nose shape. These are the photos before and after correction of a nose. The man had his nose straightened, nose tip lifted, and strongly protruding part of the acanthion there removed. So this has changed his profile greatly. Earlier in the ancient Greece, there was a concept of ideal beauty, presuming that in profile a person's forehead should pass straight to the nose. Look at these sculptures and at someone's mock picture, which is an attempt to illustrate how a model with the features of an ancient statue might look nowadays. So this woman looked similar, but she didn't like it. And additionally, to removing the bulge, she has had a part of her nasal bone cut up to this spot, which is called nasion. So this is the frontal bone. These are nasal bones. This is the anterior nasal spine of maxilla, and this is the nasion. So the more prominent it is, nasion, the more the face resembles to the ancient Greek beauty ideal. But this feature is more or less spread even nowadays. Have a look at Drew Barrymore. Her forehead median gradually passes to the nasal arch, and it looks almost like a straight line. Another example is Uma Thurman. Of course, her angle between the nose and the forehead is not a straight line, but it's very close to the Greek ideal. Or take, Yuri Kaplan, this guy. His forehead median relatively gradually passes into the nasal arch as well. And to compare, if we speak about Alexander Rybak, His nose is not altogether Greek. His nasion and nose bridge are not that big, and it's absolutely different. It's another type of beauty, actually. Also, Britney Spears had a strong nasion and a somewhat Greek profile. The same with Alla Chernyshova and Yana Churikova. Lera Kudryavtseva's nasion is somewhat deeper, and although her nose has a prominent bulge, it cannot be called Greek because her forehead doesn't pass into her nose as a straight line, so it's not Greek. Jessica Simpson's profile, despite her bulge, cannot be called Greek either. Mila Jovovich has a weak nasion, as well as a Schweier eye. Monica Bellucci's nasion is big and prominent, and her nose is very interesting one because it doesn't become wider downwards because her lower lateral cartilages are narrow and nose wings are small. And I'd like to add that the shape of this spot, the nasion, is also formed by muscles too. These are the frontal bellies of the epicranius muscle, and these are these are corrugator supercilii muscles that wrinkles brows. If they are big, the bulge will be bigger. And below there is a procerus muscle, I don't know how to pronounce, that starts from the nasal bone and the lateral nasal cartilage, goes upwards and is attached to the skin above the root of the nose. So if the procerus muscle is weak, the shape of bone followed at this place. And if it's well developed and big, this place will look differently and follow the shape of procerus muscle. And also, don't forget about the fat tissue. The thicker it is there, the more round and streamlined is this place. So now we understand how the nose is built. Next come the eyes.